Welcome back to T-10, everyone. I'm Tim Fitzpatrick, and today I am joined by Clint Hooper, who is Senior Director of Operations for South Carolina at Fresenius Medical Care and a good friend. Clint, really good to talk to you. Thanks for coming on.
Absolutely. Thanks for having me, Tim. Always a pleasure, man.
So obviously I've known you for a couple of years now, but I think the first time we actually have a pretty funny story for how we met, but I think it'd be helpful to have you give a high level background on kind of who you are, how you got into your current role, and just let the people know who you are.
Yeah, absolutely. And I was just talking about how we met the other day. It's a very funny story. But yeah, so I am a senior director of operations with Fresenius. Um, Basically started off as on the inpatient services side of our business as a program manager. Kind of that's really where I got exposed to how a new dialysis patient hits or crashes into the hospital, and we call that like a patient that's not being followed by a CKD diagnosis in a nephrology office, and all of a sudden lands in a hospital. They do lab work and they're like, "Wow, your kidneys are failing. You need dialysis." And that really kind of started my whole interest into meeting these patients where they were and making sure they landed where they needed to. And spent a couple years doing that. And quite the transition from an ER nurse, and really fell in love with like our entire mission with our company, and wanted to learn more about the chronic side. So started out as a chronic DO over a small amount of clinics there in the Florence area, and my market has grown with my responsibilities. So now I oversee the inpatient services side, but I also have the chronic side as well. So it's a busy job, but it's very rewarding.
I'm sure, so this is great because, believe it or not, we have not really discussed a lot of the settings that you've already kind of alluded to where you've worked on this show. So some people may not be as familiar with inpatient versus chronic.
Yeah.
I'd love for you to kind of dive in, if you could, and talk about what are those settings. I guess to start, just what are the settings, and then maybe talk about what you've seen in terms of education in those settings and how that kind of works for patients.
Absolutely. So I myself, as an ER nurse background, I only knew that people went to dialysis 3 days a week in a clinic. And so that side of the business in the clinic, that's your in-center setting is what we call it, or your chronic setting. And so that's where your average dialysis patient who gets diagnosed with end-stage renal disease, told they're going to be in dialysis, they'll either go on a Monday, Wednesday, Friday routine, or a TTS, or Tuesday, Thursday routine. And that's probably the largest book of any dialysis company's business, just because that's primarily where our patients land right now. And then you've got the inpatient setting, and that is where more times than not, a dialysis company like us will partner with a hospital, and we'll act as a vendor. So we'll come into their hospital and they'll outsource that service to us. It's what we do on the outpatient setting for a living, and that's where we meet new patients that just kind of like I described earlier, that land in the hospital after not knowing what's going on and not really following their health care. And all of a sudden they've got kidney failure and didn't know. And it's also where our chronic patients, so we do know, generally will get admitted. And so we can still carry on that quality dialysis treatment while they're in the hospital, getting them out quick so they can get plugged back into their clinic. And then lastly, you've got the home therapies segment, which has been around for a while, but as we all know, is the focus of kidney care for the last couple of years. And huge push to grow this. And in doing so, home therapies education has really been on the forefront. For years, but I've seen, I joined our company 5 years ago, and I've seen it grow in just the 5 years I've been here. And now we're educating everywhere we can, whether it's in the inpatient setting where we try to make sure we partner with our inpatient services teams to make sure they know what they're educating on, giving handouts for, what to expect as a new dialysis patient, home options, partnering with the hospital to supply them with content. And then, of course, we do some exposure and training in center as well. just trying to figure out any way possible we can kind of meet our patients where they're at. They're in the clinic, and showcase what home therapies can do for them in their life. So yeah, we're educating a ton of different ways right now, trying to get creative, and just reach as many patients as we can.
Yeah, I'm really glad you brought up the fourth kind of segment setting you mentioned, which is the home therapy side. For those who listened to the previous episode with Vanessa Evans, who's Senior Manager of Advocacy and Communities, I know this is a huge part of her focus. There's probably a lot of overlap with kind of how you think about things. Can you talk a bit more about your, like from an operations standpoint, you're thinking about South Carolina, about Florence, about your region. Where do you see, you just mentioned kind of a lot of patients are in center, but also that there's a lot of attention on home. Where does that transition fit into how you think about where dialysis is, where patients are at, and kind of how you bring education to them? Because I know you kind of alluded to a few ways to innovatively get content there, whether it's in the hospital or meeting the patients where they are. So how do you think about that in your role?
So I think, anybody you talk to in healthcare that's in operations, I think before even talking about operations, you gotta address the elephant in the room, and it's staffing. Staffing is a huge, huge, huge obstacle. Unfortunately, I mean everywhere that I know of, but especially in healthcare. And so retaining our team members, showing them they're valued, especially through some of the last couple of years, has been a big, big goal of ours. And, figuring out how to accomplish the same thing with less people without sacrificing any quality, and that's so operationally, that's really been our focus. And how can we be innovative? How can we be creative in our approach to doing this? And from an operations level, there's a lot of moving pieces. These patients, how do you get this huge group of in-center patients who've just landed in the clinic setting because they just didn't really know their options, or maybe just didn't were not in a frame of mind to just be trained at that point on their options, or maybe the delivery wasn't there, and so now they're getting just 3 day a week dialysis. And so once you get them there, operationally, how do we figure out transitioning them home? What does training look like? What does exposure look like? Who's going to do that? Who's going to own those goals? And so it's been a huge cross-functional collaborative effort, I think, amongst our entire organization, to just come up with unique ways to do this. And we've really done a number of different things. I mean, transitional care units have really helped us, where we've taken, say you've got 4 to 6 clinics in a 30-mile radius, real concentrated area, because you don't want to cause any hardship to the patients at all. But we'll take and target these areas, and we'll also partner with the hospital and tell them what we're going to be doing. And the goal is to send all new patients to this TCU setting, which is in one of our clinics. We just kind of mark out a little area for it. And it's a 4-week program where we just educate. And of course, the hope is that this patient will go to home therapies, because we know how good that is for them and what that'll do for them. But at the end of the day, it's to educate them on all their options and ease them into dialysis gently, so they can absorb the information, be on dialysis without feeling bad, and really make an informed decision at the end of that 4 weeks to what modality they want to choose.
So I love this for a few reasons. Obviously, your background, which I know RN, but also MBA. You've been at the company 5 years. You've kind of seen how ops work, and it must be a very cool, surreal feeling for you to have seen from the ER nurse side, to kind of this opportunity with TCUs, and just the real opportunity to help patients who might have been overwhelmed, who didn't know that they had kidney disease and ended up crashing. So on that note, I think it'd be great to hear you talk about TCU as a perfect example. Are there other programs, or how do you think about the opportunities to continue trying to educate patients effectively, and to kind of meet the challenges that you're describing from the ops perspective?
Yeah, of course, internally, I think with any organization, just good communication and that cross functional collaboration is key. Bringing all the players to the table, people who've done it before, people who are good in their specific field, whether it be with training patients or with different staffing models to do more with less. But at the beginning of the day, you've got to have the right person doing it for the right reasons. And the reason, we do all this is, especially from a nurse's perspective, I'm an advocate, by nature. And we're really, as a society in healthcare, we do these patients a complete disservice if we don't make it our mission to ensure that they know everything about every option they have, because it's life changing what home therapies can do for them. It is, and as nurses, as healthcare professionals, as operations, it's our duty to make it our mission to educate every single one of them, so that at the end of the day, if they do choose whatever modality they choose, we know that they choose what was best for them based on being educated. And so, with that being said, I have definitely been investing a lot of time into figuring out different ways to do this and partnering with the right people, in our region. And I think the opportunity really comes with, how do we educate folks in every setting? How do we control that delivery of information, and what should that information be to guide them through the appropriate paths? And I think that's really what we're in the middle of finding out, along with everybody else in the country. How can we do our best to educate these patients the best of our ability to get them where they need to be so they can have good, productive lives?
I love this. So I thank you for, I mean, seriously, you and I have spent a ton of time talking, but just every single time, the passion, anyone here meeting you for the first time, I hope they know that this is the Clint Hooper that they'll get when they meet you. So thank you for diving in there. Of course, I do. So I know we're last question here before we kind of wrap things up, but opportunities, optimism. I'd love to know just on time scales, right? So next 12 months, maybe, are there opportunities? What are you excited about? And then kind of longer term, I love to ask the question around, hey, if you could write the future, if you could think more longer term about what does the transition to home therapies look like in 5 or 10 years through the lens of education, where are you on that short term and the long term, if you can?
Yeah, I mean, this everything that's in me lives for this initiative, so I can talk to you forever about optimistic thoughts that go through my mind. But the biggest thing for me is when I look at kind of how I've seen just even our organization, society, our nephrologists, just people as a whole. Nobody likes change, right? I mean, it's hard to change. It's hard to feel vulnerable and humble again and new in the space that you've been working in forever. And I think that's a big barrier in overcoming, to get the buy-in we need for folks to step out and learn more about home therapies so we can attack this. But what's exciting is I'm seeing that happen, and that's hard, and that says a lot, that people are shifting. And so innovation is really on the horizon here, and that's the most exciting part of all this. We no longer are expecting different outcomes with the same actions, and you're seeing it. So the old adage, you can't expect to achieve these lofty goals with the same actions that you were doing yesterday. So we're really trying any and everything we can. We are pulling out all the stops. We're open to different techniques, tactics. And one of the most exciting things for me is just really been working with your company and just seeing how virtual reality fits into that space, whether, no matter who it's with, just how virtual reality can aid in just educating anyone that interfaces with it, because of the type of technology it is. It transcends all types of learners to that immersive environment that you're in. And I've just been blown away at what I've seen thus far, and what's on the horizon, and what that's going to look like in terms of helping more patients know what they're getting into, and really understand what they're getting into well before they get there and realize, oh, this isn't for me. Maybe I should have listened more about that home therapies. I'm not really liking the way this makes me feel. What were they telling me? What's that machine look like? And it's just exciting to be able to manage expectations and really teach our patients, just with another approach.
Well, Glenn, I appreciate you. I'm fired up. I'm ready to keep going here on my end after this conversation, as always. But I think
Me too.
before we wrap up here, how can people get a hold of you if they want to connect, they listen, they're inspired, they want to exchange notes?
Yeah, I mean, I'm available to anyone who wants to pick my brain about how to grow home, how to reach patients. And I'm on LinkedIn. That's probably the easiest way to get a hold of me. I believe I'm under there as Clint Hooper, not my government name of Arthur Hooper, but pretty easy to find. You type in Clint Hooper, Fresenius, and I don't think there's only one of us. So
I think so too, but I'll make sure that we have that in the show notes so people know where to find you. Clint, I just want to say thank you again for everything, but for coming on and sharing your perspective.
no, it's always a pleasure to talk. To talk initiatives, goals, and how we're going to get there with you in terms of the kidney space. So thank you for having me on.